The death toll continues to climb by the hour, and more than 50,000 people remain missing or unaccounted for after two brutal earthquakes devastated northern Venezuela. This as rescue crews work tirelessly, racing against time to search through collapsed buildings to find survivors trapped in the rubble. As survivors face growing needs for shelter, clean water, medical care, and other essentials, we're now joined by the head of region for the Americas with the Canadian Red Cross, Juliana Bravo, to discuss the humanitarian response and what's still needed. Hi, Juliana. Thanks so much for joining us today.
Thanks for having me.
So, Juliana, can you briefly begin by describing the situation for your volunteers on the ground? What are you hearing from them?
Well, the Venezuelan Red Cross, which is really the local actor, the first responder in this case, despite being affected themselves, they are active in the ground. We have been coordinating and collaborating with other partners and actors in the region. But as you can understand, and you described it well, the first hours have been very intense and really addressed by the local actors with the search and rescue efforts. Parallel to this work done by the colleagues in the Venezuelan Red Cross in the first 72 hours, we've been coordinating as part of the big umbrella network that is the Federation of Red Cross and Red Crescents. You know that the Red Cross and Red Crescent is the largest disaster relief organization in the world. And part of what gives us this strength is that we have local actors in place with our different Red Cross societies, but we also have this structure and these relationships and partnerships built over many years that allow us to coordinate amongst ourselves and also with our governments, in our case, the Canadian government, a great supporter of our response to Venezuela, and make sure that we can provide the necessary for the very first relief work.
Okay, and what are the most urgent humanitarian needs you're seeing right now? Is it food? Is it shelter? And where is your organization currently focusing its efforts?
Well, the first week or 2 weeks, what we see often in these cases is, of course, the need for shelter, as you mentioned, for food, safe water. Sanitation is another area that is important. In this case, also healthcare services, medical services for the people that they managed to rescue. The Venezuelan Red Cross in the terrain is actually offering the transportation. Their network of hospitals and clinics with some damage, but they are still operational. So they have needs for medication, for supplies, also for just the equipment of the first responders. I think that this is something that we are in the midst of all the darkness that you see in these videos and in the news. I can tell you that the work that we do in between disasters, let's call them, we have pre-positioned some medication and some other supplies that are being used in Caracas that actually we were feeling really good to know that this were actually being of aid and of help for the people within the very first hours because they were already in Caracas, right? So we are now contemplating further deliveries. In fact, at only 48 hours of the earthquakes, thanks to a collaboration with the International Federation of the Red Cross, our coordinating body, and with the sponsorship or with the support of the Canadian government, we had a charter flight. We supported a charter flight that arrived already in Venezuela with 5,700 emergency relief items, including foldable beds. What I mentioned to you before about some water filters, for instance, because it's one of the big needs, tarpaulins for some temporary shelter, and many other items to offer some initial care and dignity for the people in need.
Mm-hmm. And have the earthquakes compounded Venezuela's already existing humanitarian crisis? And given the significant economic and infrastructure challenges made worse by the quakes, how has that complicated, relief and recovery efforts? And I have to ask you, there are still tens of thousands of people still trapped under the rubble. So how has the communication been with family members?
And well, first of all, to address, it is a very complex response. And one of the pressing needs, of course, is for people to find their loved ones. And there's a service that I think I see an opening here, and I thank you for making it, to offer the services of the Red Cross in the region, not only in Canada, about finding family members. So I invite people to browse our website, and they can actually do a search for Canadian Red Cross Finding Family. And we coordinate with other Red Crosses, let's call them, or other organizations of the Red Cross in the Americas, and also with Venezuela. And we do our best to try to also reconnect relatives. And this is a need that we have heard uh, very much expressed to us in the last hours, and that I'm happy to relate here to folks listening to us.
Okay, and finally, do you believe the international response is matching the scale of need? And for those watching here in Canada and want to help, what kind of donations or support will make the biggest difference in the days and weeks ahead?
Well, when emergencies of this size and scale occur, really everything helps. And I think we are just starting to uncover the actual numbers and the human loss. And as you mentioned before, the different pre-existing needs are now further exacerbated. So we are very thankful for the Canadian public that have generally started to donate in our website. We have an active appeal for response to Venezuela. We think, and we call the diaspora and the Venezuelan community in Canada, that the best way to contribute is really donating funds, because transporting items, aside from taking the logistic effort, is cost. So the most efficient way is to donate, and we ensure that we can position the money with other partners, Red Cross partners, that can deliver. An example, neighboring Colombia, they can actually transport by land. So we coordinate with the different partners, actors, neighbors of Venezuela, if necessary, to deliver. But as I said, even a charter flight was already sent and landed in Venezuela with the first relief.
All right, Juliana, thanks so much for your time and insight today.
Thank you for having us.
That is Juliana Bravo, the head of region for the Americas at the Canadian Red Cross.